Hello, everybody, and welcome to this session of Cassandra, the session on climate change and health. My name is BERND. I'm working at the European Commission Science Service, the Joint Research Center. And I'm really honored and pleased to have today with me four high-level representatives of a scientific community, of an NGO environment, which is very vibrant at one side, but also struggling to bring over the message. I'm here today with Christine NABIRYO from PATH, an international governmental organization working very much with us in the European Commission, with the Gates Foundation, and with a series of players globally. I'm also together with RENEE Street. RENEE Street is based in South Africa, and she is working at the interface between science, situated on environment on one side and health on the other side, and most importantly, between people who live in different realities and face impact of climate change, their consequences on health on a day-to-day basis. Then we have with me Professor Dr. SOEREN BECKER. He is from the University of my hometown here, the region of the Saar in southwestern Germany, an international expert on communicable diseases, and investigating with his team questions on how climate change and other factors affect the appearance or reappearance of certain diseases and what can be done about it. He is situated at a medical school, so he is training actually the doctors of tomorrow, and this brings in the general practitioner's angle, very important. So there is, of course, a perception of climate change and health interactions, and then there's a reality which is not always the same. Last but not least, I'm working here this session together with MUKHLID YOUSIF. MUKHLID is based also in South Africa, but he works for the African CDC on behalf of the African Union. The African CDC, the Center of Disease Controls or Prevention of Disease Controls, is our primary partner of the European Union when it comes to roll out surveillance programs, genomics, and build the necessary capacities. So welcome all to this session. Before we come to our discussion and your own presentation, I think we have from each of you a little video clip, and I would call the directors behind the scene to launch the videos.
A path is a way forward. This is the way we look at things forward. Because not everyone gets a chance at progress. To grow, to be healthy, to have a voice, to live a full life. This inequality is in front of us, and we can look away or we can look ahead. We know that when people are healthy, all of humanity moves forward. Better health means stronger countries, growing markets, shifting economies, social progress. It turns problems into plans, research into innovation, and saves more lives in fewer lifetimes. This is what we do at PATH. We are thoughtful, we are passionate, we are committed, and we are pursuing healthy progress for all.
It's no longer a question of whether climate will affect health and safety of communities and populations globally. It is our lived reality right now. With Cyclone Freddy striking southern Africa last year, with the floods that ensured cholera epidemics, with floods in eastern Uganda and Bali, the anthrax, a disease that had been under control, with mental health of populations affected, NCDs, people living with diabetes, hypertension, having to face yet another emerging threat. I could go on. Malaria in the US, dengue. Moving swiftly on to PATH. PATH has been at it since 2018, and we are working, if you come to COP28, we'll be there, showcasing some of the work that we're already doing. At global level, at regional level, Africa level, with the Africa CDC, WHO Afro, we are talking to the countries, Ministry of Health, WHO focal points in country, to work on national, support governments with the national health adaptation plans. But the elephant in the room is funding. If we don't act now and resources flow right now, we are in danger of history repeating itself, just like we saw with COVID. My message to donors here, my message to leaders here, Africa needs your action now.
My name is SOEREN BECKER, and in my view, climate change is affecting health in many ways, which is reflected, for example, by the increase of both infections and non-communicable diseases. While this is a reality that has been well documented in many parts of the global south, it is certainly not limited to such settings, as has recently been documented by the spread of previously so-called tropical viral infections like dengue or chikungunya, also in parts of Europe, which again has been facilitated by the spread of expensive and invasive vector species such as the tiger mosquito Aedes albopictus. However, also the changing epidemiology in connection to climate change in previously endemic areas like sub-Saharan Africa is, in my view, still under-researched and under-documented, as also the changing and shifting epidemiology of malaria in such settings. Hence, I believe there's a lack of internationally harmonized surveillance and also mitigation strategies. But apart from pure surveillance, there's also an urgent need for surveillance response systems that are tailored to different phenomena and could, for example, rapidly react after flooding events or other weather extremes to elucidate the emergence of pathogens like waterborne pathogens and other causative agents. Another important point in my view is the close interconnection between climate change and international migration, because migration from many low and middle income countries is certainly accelerated by the effects of climate change, for example, on local agriculture, and hence I see an urgent need for a more coordinated approach and efforts toward the integrated management of global migration movements. Thank you, and I'm much looking forward to the panel discussion.
Hi, I'm RENEE Street. I'm the Interim Director of the Environment and Health Research Unit of the South African Medical Research Council. I'm based in Cape Town, South Africa. Climate change intensifies extreme weather events, leading to more frequent and severe natural disasters, such as hurricanes, floods, wildfires, and heat waves. These events can cause injuries, displacement, and psychological stress, affecting the physical and mental health of communities. Globally, billions of people live in areas susceptible to climate change. And while the impacts of climate change on health are a global concern, they tend to disproportionately affect communities in low and middle income countries. These regions often face greater vulnerability due to limited resources, inadequate infrastructure, and socio-economic disparities. South Africa is a middle-income country and has one of the highest inequality rates in the world. The South African government supports key climate actions, including having a Presidential Climate Commission, a National Climate Change Adaptation Strategy, as well as a carbon tax. But more needs to be done to protect the most vulnerable communities. Recently, the city of Cape Town and surrounding areas had one of the worst droughts in 100 years, which severely limited critical water supplies. Implementing early warning systems, resilient infrastructure, healthcare preparedness, and community adaptation strategies are crucial to mitigate and manage the impacts of climate change. Shifting towards greater reliance on renewable energy and reduced dependence on fossil fuels is vital for a sustainable and cleaner energy future. However, the mineral intensity of low-carbon technologies needs to be considered. The production of solar panels, wind turbines, and energy storage systems require metals such as lithium, cobalt, and copper. A recent World Bank report has highlighted that while the increasing demand for metals and minerals provides exciting economic opportunities, especially for resource-rich developing countries, the clean energy transition could also present significant challenges if not managed responsibly and sustainably. Today, simply reducing carbon emissions is not enough to stop the impacts of climate change, and we need to start adapting to such changes. Adaptation strategies need to be locally relevant, considering environmental, social, and economic conditions. While we navigate this complex situation, we need to ensure that we focus on ambitious yet realistic goals. Thank you.
Hi, my name is YOUSIF. I'm a scientist and the program lead for the Wastewater Genomics Syndicate at the National Institute for Communicable Diseases of South Africa. I am based in Johannesburg, South Africa. According to the World Bank definition, the climate change is the significant variation of average weather conditions becoming, for example, warmer, wetter, or drier over several decades or longer. This definition manifests in our daily lives as a severe weather condition that leads to natural disasters such as floods, storms, heat waves, fires, hurricanes, and earthquakes, and many more. The climate change has a direct impact on our health in many ways. It can have a direct impact on health through the extreme weather conditions that could make a huge disruption to the food and safe water supply to people. And it can also affect people directly by these consequences in their mental health issues. The consequences of these environmental factors as well can increase the risk of zoonotic infections and spread of vectors that could cause increase in infectious diseases. Specifically in low middle income countries, these situations often became even more worse due to the limited resources and inappropriate infrastructure. Lots needs to be done, particularly in Africa, to combat the effect of climate change for the people. There are several ways in which we can fight or we can change the climate change. The African Development Bank have adopted some key solutions for action plan. They promote the use of sustainable land use and water resources management, building resilience of key infrastructure in urban systems, and enhance investment in clean energy, and many more. Thank you.
This was, again, an impressive collection of statements and insights in work of people coming together under the lead of Cassandra. Thank you so much. I will try to touch on different aspects by asking a few questions which I must admit I did not prepare, because I believe it is more authentic if we jump on spontaneous reactions, and this is the charming thing. Søren, I would like to start with you. You said something on migration, which is triggered by climate change. Are now working in the European Commission and working closely with our knowledge center on demography and migration. I know that the narrative which you touched on is not exactly 100%. What the figures tell us. So we see, yes, a migration from rural areas to the urban settlements, but normally it stops there because people are not equipped from a resource perspective to move on. What we do see is a growth of informal settlements. And maybe here the first questions, starting with Søren, but then let's take a tour. This growth of informal settlements with lack of sanitation, with lack of infrastructure, isn't this something which is an underestimated risk at a global scale?
Yes, thank you very much, and thanks for taking up on this. So you're absolutely right. I didn't mean exactly that, let's say, climate change accelerates migration from low and middle income countries to higher income countries, but rather also within country migration and within different regions. And there I fully agree that we know that for many, both bacterial pathogens, viral pathogens, but also parasitic pathogens, access to water and improved sanitation is one of the best preventive things to have. And in many informal settlements, you certainly will not have the access you'd like to provide. And so I think this is certainly a specific risk. What perhaps on a larger scale could also be discussed is, for example, antimicrobial resistance, which is also prevailing and is getting more and more difficult to manage in many settings. And there's also quite a well-documented association, for example, between the opportunities to survive in warmer water for different waterborne pathogens, bacteria, etc., in comparison to compared to colder water. So there's also like the temperature thing, but if we really talk about the migration, I think that's especially the lack of infrastructure in informal settlements that poses a specific risk. But others certainly can comment on that.
Thank you, Søren. Christine, assuming that we somehow agree on this assessment, and you mentioned in your video, well, the elephant in the room is funding. So there's not enough funding. I absolutely agree. But let's assume we have funding. Where and how should we invest this? How to prioritize? So you have a lack of everything, and now you have to make a prioritization. How would you, as PARS, consult us or recommend us to do this? You're muted, I think.
I'd say that there is an opportunity at this time for us, because when you have had less funding, then you are put in a situation where you have to think outside the box and start working with your bare hands. And that's what's happening right now. And I see this reflecting of what happened when we had HIV/AIDS, and there were no drugs on the continent, and we had to take care of the patients and just do the bare minimum and use whatever resources we had. And right now, what's happening, and I'm glad that that question has come at this time, because right now the PARS team is in the middle of putting together a proposal that is looking at how do we support countries in terms of the assessments that need to be happening. And some of the countries haven't even had the opportunity to do the vulnerability assessments, because that should be the starting point. And beyond the vulnerability assessment, then you will be able to outline what is needed, what are the vulnerabilities, which populations, where do we focus? And to me, that's the starting point. And then after that, you do get the priorities after you've done the assessments. But we all know what the health systems are. So it goes without saying that what WHO has outlined for us as climate resilient health facilities, as environmentally sustainable health systems are the guidelines that, in the broad sense of things, has already looked at what is needed in these communities and said, this is the blueprint, and that's ready to go. We're ready to go with that. And also hinging on the WHO building blocks, the climate resilient and environmentally sustainable health systems, you just go by governance, that's the big bucket, the political commitment, and working on the engagement of the leadership, and ensuring that you've set up a system that has governance, that is leading the communities at national, global, regional, continental level, then down to the communities, subnational. That's very important. The districts, the provinces, and the governance of how we are going to handle things. Then what is the service delivery looking like? What are the human resources for health? Are the health providers trained? And the discourse right now at PATH is each and every one of us at PATH engaged with climate and health? And as we go out there, are we able to integrate this? Because the resources are limited. But indeed, if we do the integration piece, if we do understand what in our own technical area needs to be added on, an add-on for climate and health and whatever area we are doing, then we are making that resource stretch a bit more to integrate and be able to be relevant to the times. I could also go on and talk about data and digitization and making sure that we are able to
This
connect.
Is the question for MUKHLID.
All right.
This is the question. I will go for MUKHLID. Christine,
great.
I,
that goes to MUKHLID. But in a nutshell, Bernard, to zero down and summarize, is to say that if we do have the resources, we already have the blueprint and we're already doing these things. If anybody here has the funding, we have a concept and we have a proposal ready to go. And that is based on WHO building blocks that is built on the national priorities as we see them. And the 1, 2, 3, ABC, that is vulnerability assessment, and then taking it on from there. Back to you, Brand.
Thank you, Christine. Sorry for interrupting, but I said it's a talk. But I found this intriguing because it was for me so obvious when you started to talk about the prioritization. I said, okay, now we have prioritized, and Renee, I'm coming to back you later on after MUKHLID with the question on the local community, because I know that you are very active. But MUKHLID, SOEREN also started about, we often don't know. We work on poor databases. We have limited information, and then we ask somebody like Christine, well, can you please recommend us where to focus? Now what do you do in order to improve this databases, and how do you ensure that we are not taking away already limited resources, for instance, from clinical surveillance, in order to create some innovative stuff like wastewater surveillance, which is new. So how do I maintain and increase my efforts, for instance, on WASH, or water sanitation, supply and sanitation, increase my clinical surveillance capacity, but still find innovation? And how, African CDC, how do you do this? What is your roadmap?
Well, I mean, if you look at the idea of doing clinical surveillance from public health point of view, I mean, since people start doing clinical surveillance, it's to understand the prevalence of each disease in the population or in the community, and to be able then to navigate how you're going to respond to such a disease, whether by prevention, whether by vaccination, and so on. But if you now try to bring the climate change issue here, which is pretty new comparing to the public health responses in general, this is a completely different story here, because we are trying to target something that we don't know. As you said, we don't have enough data. If you ask me now, and I think the Prof also mentioned about the increase of AMR globally, or even in Africa. So we don't know what is the cause of that. It could be the climate change, right? So the increases of all the infectious diseases, all the zoonotic diseases, definitely it has some relation to the climate change. So what you mentioned about the wastewater is actually, in my opinion, is one of the options to be able to mitigate the responses, or to be able to increase the sensitivity of our surveillance. Because we lack in data and we don't know exactly the number of pathogens, even the surveillance system from clinical perspective is not sufficient. So implementing wastewater surveillance might be the solution for that, because you're looking for population surveillance or community surveillance. You're trying to survey the pathogens in the community, even that it was not detected in clinical setting, even that if you have some people who have no symptoms, you could have people walking around carrying some virus or some bacteria that are infectious, but their immune system somehow managed to adapt and managed to fight that disease. When you do the wastewater surveillance, you'll be able to have a complete picture, whether these people are symptomatic or they are not symptomatic. And that is very helpful in order for us to try to draft policies or responses into that. From Africa CDC perspective, I mean, recently Africa CDC start also getting to be aware of the wastewater surveillance. And in addition to the other tasks that Africa City is doing, which is building capacity and advocacy and putting some frameworks and guidelines to the continent, to the African member state, also wastewater surveillance is starting now. So we're trying to build also some capacity in the AU member states. We're trying to draft some policies, and we're trying also to work in addressing the real questions in the wastewater surveillance, because the real questions also in how to do it, and a lot of talks about the data sharing agreements and the generation of data, the data repositories. It's complex situation, and I can go along with that, but I think I'll stop here then. Thank you.
Thank you, MUKHLID. We definitely come back to capacity in the second round of questions, but I would like to go a little bit more to what RENEE said in the beginning when she explained a little bit her role at the interface, environment and health. And you were actually the only one, I believe, who mentioned the issue mental health, which kind of we tend to forget or don't frame it correctly. And I know also, that's how I met you, that you actually really go into these realities, informal settlements, extreme poverty, and the most shocking sentence I've heard about the realities there was people there don't have time for Corona because they are busy in surviving. It does not mean that they're not suffering from SARS-CoV-2 infections, but there are zillions of other issues related to their health which are more immediate and health threatening. So question to you is a little bit, now we talk about climate change and health, and we talk about innovation and prioritization. How do you see this if you look into the realities you're facing every day? Are we getting it right? How do we engage with these people? What is needed at local level? Sorry.
Thanks, Bernd. So, the people whose health is really being harmed first and the worst are people that that contributed the least towards the cause of climate change. And this is quite an accepted sort of statement. But recent study released by WHO showed that over 35% of heat-related deaths were due to human-induced climate change. And in vulnerable regions, the death rate from extreme weather events in the last 10 years was 15 times higher than in least vulnerable areas. So it really is people who, that these local communities do need the support mentioned by the rest of the panel to see. But Bernd, as you mentioned with coronavirus, it's not like people weren't affected. They may not have time to, to really connect. They need to, get on with their daily lives. And I feel the same with climate change. It is such a big thing, difficult to explain and digest when people are really just trying to, make a living and survive day to day. I think there's some great science being done by scientists working directly with communities, but unfortunately that's not always translated across, it doesn't always reach the communities that are most deserving. I saw a stat yesterday that said 70% of science is stuck behind paywalls, and that's a major issue. So if that is not getting across to the people that need it to be translated, up or downstream, that's a major problem there, with links very much to Christian's issue on, of course, the financing issues. Thanks.
This triggers a nasty question now for SOEREN, because you touch on something which is very dear to me. And when I met Christine, our meeting in September in South Africa, we were talking about that, about how do we train scientists? Are scientists really getting it, that they have a social and socioeconomic responsibility which goes beyond producing papers, producing science? So a very provocative question to you, SOEREN. How do you make sure that the students that leave your courses, your curriculum, are fit for life and not trained scientists to seek only the recognition of the peers? How do you do that?
Yeah, that's an interesting question. Well, let me first start by saying that from my perspective, it is already a dilemma right now that in medical sciences you try to get the people ready to work as doctors, and at the same time in different countries worldwide there is also quite some movement right now towards educating everyone also to be a scientist in a certain way, because like those who do the publications normally is of course a small minor fraction of those who studied medicine and who work on the in the front line of medicine, so to say. But I think we all have learned that to really apply recent knowledge and perhaps apply it more or less immediately, and avoiding that it takes maybe 2 or 3 decades until evidence-based science really reaches the patient, which is frequently the case. Everybody needs to have a sound understanding of how science works, also to avoid to avoid potentially dangerous misunderstandings. So I think this is something where we are perhaps right in the process right now, that everybody has a sound scientific background. But I fully agree that especially if it comes to the dimension beyond pure medicine, like for example cost effectiveness of different interventions, etc. This is something health economics, health ethics, global health, planetary health in its whole. That's something that is absolutely underrepresented, at least in the curricula of medical students in Germany and Italy, which I know a little bit, but probably in many other countries worldwide as well. So we're currently right in the process in Germany, for example, to get global health and planetary health a little bit more central and as a more compulsory element of medical studies. And this is something which is basically driven by the young generation. So it's been the medical students first who really augmented the pressure on the system, which is good, because otherwise we wouldn't be at that point right now. But there are certainly some countries who are doing better, but I think in general there's still quite a long way to go, really, just to make everybody aware of these challenges, and certainly a much longer way to make them fit for science or fit for every day, what you mentioned in your question. Sorry if it's a disappointing question, response, but it's somehow realistic.
I'll jump in there, Bernd, and say that yes, in our discussion with BERND, it was very clear that we are trained as scientists, but the real world does not understand what we are about. And the common people want to hear the information in a way that will relate to them. So you know what will make a difference in their lives, but the way you communicate it. And I would say that there is a group that is trained to do the communication, their engagement with the communities. And it's important that we as scientists up our game in terms of that skill. But even in the midst of that, let's do partnerships. We can't do everything, but we can partner. But we do have a responsibility as scientists to up our game with communication, because people look to us, and if what we are saying is not making sense to them, then it's a lost. There is a big missed opportunity, and that's why the science takes so many decades before it is translated into policy and acceptable to the policymakers and to the people. But we've seen with COVID that we could actually make that faster by incorporating community engagement aspects, bringing the communicators on board, and even we ourselves becoming communicators. Like right now, we're communicating. And I'll give you a brief snapshot. We were at EDCTP in Paris last week. And one of the things that we got together was a group of young scientists, female, and a group that is a mixture of both male and female. And one of the messages that is going on, a very exciting group forming, and we are saying, come EDCTP 2025 in Kigali, we will fill that platform and share that This is what we were able to do as scientists without an EDCTP grant, without any European Union or Bill and Melinda Gates Foundation grant, but we taught each other how to communicate, because some of us can communicate. So can the rest of us learn from each other? Josephine today is in Singapore and she's sending us her presentation. What can I do? How do I do it different? Some of them are tuning in now to see how is Christine doing it? How is BERND doing it? And how should we do it? So we can up our skills and we can go a long way. I'd add, BERND, from the question that you asked previously, still at the gear desk outside in Paris, outside my hotel, I found this young girl and she was talking to me very rapidly. My French is very small. So she was saying, Madame, and I said, what is going on? I'm sorry. In Africa, if a young person approaches you like that, you know they're asking for money. So I said, what is this young girl doing on the street asking for money? So she said, do you speak a bit of English? I said, yes, English. She said, my name is Mary, and I'm with the Greenpeace. And we are here to tell you about the environment. I said, climate and environment. Can I take a photo so that at Cassandra, I can tell them that the youth in France are on the street and they're talking and telling the people, the youth. Africa is 75% youth. The youth are the ones that will feel the heat of climate and health and climate change 60 years from today. We needed panelists here who is youth for BERND, and we needed youth. We need the youth in Africa, on the streets, everywhere, saying, protect our climate, because that's our future. Back to you, BERND.
Thank you. I want to come back to that aspect of youth and the role of Africa. And this goes to MUKHLID. One of the things, when we first met, I introduced myself. I'm BERND GAWLIK, blah, 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 from the European Commission. And I'm here to listen and learn. And I got a lot of feedback from the audience in the coffee break. Said that is not normal that somebody from Africa comes and presents him or herself and saying that. And actually, I came, I listened, and I learned a lot. And I'm now thinking there's so much more Africa has to tell us. MUKHLID, African CDC, how do you pick this up? I know that you're thinking about it. I know that you are also struggling from the fact that still you are dependent on technologies, access to information, access to know-how, or to create vaccines. And this is a topic, undeniably. So, it's nice to talk about climate change and health, but there are some very concrete and tangible needs. So what is your view on that, on capacities and leadership of role? How can we bring Africa into a more leading position to tap into this youth potential which is there?
Yeah, I think this is one of the topics that I always like to talk about. Tell the story about Africa CDC and specifically Africa PGI, the Pathogen Genomic Initiative that was established in 2020-2021. So basically it was before COVID-19, by the way, and the call was to say how many countries in the continent can do next generation sequencing. And here I have to speak specifically about the technology because it's related to the infectious disease surveillance, and also now, as we established now, it also relates to the climate change. So in order for us to do effective surveillance system, whether it's clinical surveillance or wastewater surveillance, which should help with the climate change, fighting the climate change, we need to have the infrastructure, as you said, we need to have the capacity. So in that time, we found that there's only 7 countries that have, out of 55, that have the ability to do sequencing in the continent, next generation sequencing. And this is where then the mandate for the Africa PGI started, is how can we build the capacity to be able to lift the continent in terms of the ability to localize the sequencing specifically. And with the help of many partners in the continent and out of the continent, we managed to increase this number from 7 to 35. So that's kind of like 4x increase of what we can do in the continent. So that has helped us in the continent to be able, instead of shipping samples, instead of collecting samples from country and then ship it to the next country and work on the logistics and so on. So it helped us, number one, to avoid doing that. Number two, it lifted the country in terms of ability to do the surveillance. Number three, it also increased the human resources capacity. And that also could then lead to what you've been talking about, what Christine was talking about. 75% of the countries are youth. So these, we're talking about the scientists themselves. They have been educated, they have been trained to be able to do that work. When we talk about the wastewater surveillance activities, it's the same. It's not separated. When we decided to go into the wastewater activities, we thought we have to use the same network that we have built. We don't have to rebuild a new network. We call it the wastewater surveillance. We use the same Africa PGI network surveillance that we have for the genomics and for the sequencing. We then use the same connections to be able to implement the wastewater surveillance. It is not easy. It is not straightforward because you have multi players here. You have each country with their priorities of whether they want it or interested in that or not. And then you have your human resources capacity in each country that are very, very different from country to another. And of course, as Christine mentioned, that's always come to us is we have the funding. How do we make this sustainable? Because if we wanted to make it sustainable, it shouldn't only be sitting on the donor's hand. The governments of the countries need to take care of that. And in order for you to convince the governments that they should take care of these activities, you need to bring a successful story. You need to bring evidence that this works and this is what you should be implementing. So I think we are on track. It's a matter of time until we reach that. The path is clear of what exactly we're supposed to be doing. And I like the idea of adding different layers. So during our work, we never brought the climate change to what we were talking about. I'm interested in this discussion because now I think this is going to add to our activities to say, well, one of the visions that we are, or the missions that we're doing now in order to increase the surveillance activities to prevention of disease and so on, then we can add the climate change as well, is one of our missions. Thank you.
Renee, in a sense, I would like to connect to this, but come to an aspect also which you touched upon. I think it was you saying that currently this debate on climate change and health is very much carbon dioxide driven, and that's not the full picture. Now you're in South Africa. In South Africa, undeniably, now I'm in the European Union, you're part of the BRICS country. This per se is for us a reality we in Europe struggle to understand. For us, Europe, and talking as a European, still we believe we are the center of the world and everything turns around Brussels, Paris, and Berlin, and maybe a little bit London. And that's it. But the reality out there is different. The world is changing. And South Africa is clearly, at least on the African continent, a forerunner. It is an economy that is emerging and trying to make a state by aligning BRICS with Brazil, with Russia, with India, with China as well. So when you hear this discussion about taking a stand and conveying message and going away a little bit from this narrative of climate change is only about carbon dioxide, I could also argue that South Africa is very much carbon driven. How do you see your own country's position on what you have been saying? Or is it really taken on board, or is climate change something where you just don't care about? Or what are the measures we're asking for? You said very clearly we have to come away a little bit from this mitigation paradigm and really start to adapt, because we won't be able to stop it in time. So how does this translate for you in South Africa?
Sure. So we are very reliant on coal. That is that we have to try and come off onto a just transition. So we have a just transition framework in South Africa, but all those things, including especially the financing of that, it's complicated, and we need to set realistic and goals, smart goals. They've got to be specific, measurable, achievable, relevant, and time bound. We cannot, we do have blue skies ideas, of course, but we also have to be cognizant of our own reality. We are moving towards some exciting changes, but it's not enough. And as I mentioned, as I alluded to in the video, these changes also require a lot of metals and minerals. And in South Africa, we have a history of mining, which has its own issues with, the mining and health issues. We've got communities that live very close to mine dumps in Johannesburg. There's all sorts of health issues that can arise from that. So there are many issues that could still come if we are not very careful about how we do this transition. Artisanal and informal mining in Africa is a big problem. Those very vulnerable communities need to be protected, and we need to ensure that their interests are also part of the global discussion. So yeah, I think we've got a very long way to go in South Africa. We do have as I mentioned, there are a couple of things that the government has done, but always more to be done. And I think we got a lot to learn from our neighboring countries and also others on the continent. We do need to share lessons about how to make our realities. We just need to ensure that they are our lived realities are taken, seriously every step of the way to know how we're going to navigate this climate crisis. Thanks.
Thank you. This brings us, I think we have five minutes left in the call. This brings us a little bit to the wrap up of the session. I see we have lost Christine. I hope she can connect back. So I would like to do a little experiment. So it's a little bit unprepared, but I will ask each of you a question, or in which I would like to answer in maybe immediately in 3 words and then elaborate. So here comes the first one, Søren, for you. In 3 words, what would you need to engage more with people are living in other places of the world? I understand you mentioned a few countries, but I see clearly that somehow you're still very much limited to a European focused area. So if I would like to bring out, what are the 3 things you would wish for the future that you can engage with RENEE, MUKHLID, and other people in Asia, Southeast Asia, and Latin America? And don't say money.
No more. I think more awareness on all sides, especially also in high income countries. More awareness of the mutual benefits of international partnership and long-term collaboration. So I think this is something. So I think that was the short answer, and I think I'm allowed to put an explanatory phrase behind that, right? So I think this is really, as you mentioned, I can only speak for European countries, but I think also researchers have been very Eurocentric. Also, even if you work in global health, it's enough to have a look at the publication lists and numbers of author positions, etc. So I think that there's been quite some exploitation in what was called previously partnership as well, and I think there's now quite a change underway, but we also need awareness and sustainability in these long-term partnerships, especially in the high-income countries. And I think this is only a process that has started a couple of years ago, and which is not as high on the top priority list as it should be in all places.
Mm-hmm. Thank you, Søren. MUKHLID, a difficult one for you as well. Opportunity and risk. Name for each of them an example which you see in the relationship Europe-Africa on the topic of climate change and health. Opportunity and risk. I know it's difficult.
Yeah, there is opportunity. I think there's a huge opportunity, and of course, when we have opportunity, we need to make the plan. So we need to take that opportunity, convert it into solutions, generate plans, and then you have to build on that. Then you need to make sure that you have risk mitigation as well, because there's always going to be a risk of what you're doing. I would say, in terms of what we need to be doing, the opportunity ahead of us, and I would like to speak about the angle of wastewater surveillance in this forum, because it's still aligned to the climate change and health. So in there, the opportunity ahead of us is that we started talking about, this topic specifically has grown interest in globally. There is big interest in terms of the wastewater surveillance and how it can be complementary to the clinical surveillance. For Africa, this is going to be a good opportunity to be part of the solution. and to contribute from the beginning to have a significant contribution like any other countries, like Europe, with Europe, to solve or to address the challenges that we have for the wastewater surveillance. So more networks, I would say, more networks with our European counterparts in terms of studies, in terms of building infrastructure, sharing of knowledge, sharing of experience. I think that's what Africa needs. Locally, what we need to do is to have a political will as well. In our countries, we need to understand this is important, or also we need to be convinced this is going to help the public health space and the environmental space, and therefore it's also going to have effect in the climate. Thank you, Brent.
Thank you, MUKHLID. And Christine does not come back. The last question to Renee, and I have to ask this question. She will smile when I say the word. Arts, culture, and science. Arts, science, and culture. Can they play a role at this interface between the global north, the global south, and climate change and health?
Absolutely. I think, when we think of climate change, we need to look at through the lens of lives and livelihoods. And that affects a variety of different communities and interests. I support the climate, climate in all policies to ensure that we are reaching a diverse group of people and different communities in different, in different countries. But I think it is important to not forget the humanities section. There's an important lessons we can learn for how to connect. Art is such an important way people express themselves, and through art we can really connect and break down barriers. So I think absolutely it's a very important part, but we need to include it in the climate and all policies contribution that should be made. Thanks.
Thank you. I've asked the question, and this is, I've wrapped up a little bit. I asked this question a little bit because I know that Renee is using, like Richard and I, this world of arts and science as a form of local science diplomacy to bring over messages which otherwise could not reach. Science is the search for the absolute truth, and art is the search for the inner truth. And if you bring those together, you create a way that people who are not necessarily skilled in one of the two can still participate themselves and express themselves. And culture is the, let's say, the playground on which you have to play that game. This is the reason why Cassandra is called Cassandra. Cassandra take place in Africa. We presumably would have chosen a completely different mythological, cultural setting. So this is definitely something that's true. I think we are at the end of the session. I'm sorry that we lost Christine, so I have to catch up with her. I think we have touched on many of the aspects. Above all, I believe I managed to put you in contact. So feel free. I encourage this to engage with you. MUKHLID, we will meet in Frankfurt. Fingers crossed that this goes through. I hope we will have soon the answer, and also Sophonia's. Renee, I will contact you for this session in Pretoria. Maybe I make an indecent, provocative invitation to SOEREN as well, which would be followed to action. But I have to see if I can manage this. And I believe there is so much more we did not mention in climate change and health, but at least we made a start, talked about it, highlighted some aspects. And I thank you all very much for having shared this hour of conversation with us. Sorry for the audience and the public. There was a glitch. It was not caused by the organizer. It was caused by blackout server infrastructure in Spain. Take the opportunity to invite you to look for the other sessions as well. There will be recordings provided. And I'm looking forward, hopefully, to see you in Cassandra 25 in person, should this occur, or as a proposed to Richard to organize a Cassandra in Africa. That would be also definitely a highlight of this so successful series. Thank you very much indeed, and I'm looking forward to meet you soon in person again. Thank you, and we close the session.
Okay.